You've likely seen the headlines.
They're suing the company and other opioid makers.
The stories pouring out of communities.
As the opioid epidemic rages on,
Opioids no longer some secret, someone else's problem, but a full-blown crisis that people no longer doubt its existence.
I mean, I've been on opiates since I was 11 years old.
In 2017, there were over 70,000 drug overdose deaths in the United States.
But what to do? That's the million-dollar question. But the culture of shame, judgment, and misunderstanding is still pervasive.
We're labeling people who have medical conditions as if it were a choice for them to experience that.
There are drugs to reverse an overdose and give people one more day, but longer-term health and lifelong sobriety is challenging. KREM 2 presents Opioids. Time to talk. Hi everyone, and thank you for being with us tonight. I'm Laura Papetti. This special is not about solving a crisis, it's about starting a conversation. Tonight is just 30 minutes, but we have many more stories to come over the next many months. And we begin by simply letting people know about reaching out for help. Statistically, there is maybe someone in your sphere that is struggling with opioids.
Right, Laura. So throughout the next 30 minutes, we'll be running a phone number on the screen for a statewide helpline.
It can help you find support in your community wherever you're watching this from tonight. We will also be providing information on KREM.com so you can link to a website with information from talking with your children about opioids to getting direction for treatment. That number is confidential and it can help you find help in your area.
There's a lot of debate and controversy about how to best treat opioid addiction. So tonight we look at medication-assisted treatment and how it's working for two local women.
It's not a magic fix and it's only one option.
That's right, and we begin with one of those women. What started as a prescription in a time of crisis turned into a struggle for survival. This is the beginning of Megan's story. This street corner in North Spokane is for most people just a corner. An intersection at Wellesley and Pittsburgh. It's a place you drive by, stop at a light, and maybe glance at nearby Rogers High School. But back on a pleasant day in 2002, it became a crime scene.
He was stopped at the light and peeled out like he was almost intentionally trying to hit him. Went right over top of him and went right into the fence. And then the neighbor went up to him and he didn't even know he just hit two girls.
A man was driving under the influence, ran his car over a curb and hurtled at high speed into two young girls, just kids out enjoying the day.
They were having a little picnic, holding up a sign like all little kids do, honk. You know, honk as you go by.
One of those kids was 11-year-old Megan Ballou. That may have been her last day of innocence. The moment of impact sent her crashing into a world of adult problems.
I thought they were going to die.
It was the moment when she went from having an afternoon picnic to panic.
One of the officers that responded, he said it was probably one of the worst collisions that he's been to.
My left arm was really damaged. My shoulder was dislocated. I shattered the rotary ball inside of it. It had to be reconstructed. I had a nasty scar. It was all the way around my arm. And then the right side of my face was crushed, like my eye socket, my cheekbone. I have no feeling down this side of my face at all. And then I was scalped.
When Ballou tells her story now 17 years later, some of her memories following the accident are fuzzy. Her mind unclear about certain specifics, her brain clouded by hospital stays, medications, and trauma.
And so they put me on fentanyl, Valium, and Versed to keep me in a medically induced coma. And then after I left the hospital, they kept me on the Valium and the fentanyl for pain and anxiety because I was experiencing anxiety attacks. All I remember are nightmares, waking up in the middle of the night screaming, thinking there were bugs in my bed. Now, when I look back on it, I was going through opiate withdrawals.
Much more to come on Megan. We do want to know that many people take opioids for very valid reasons. However, we now know that they are highly addictive and that some prescribing methods needed to change. There are efforts in place to urge medical providers to consider other methods of pain management and regulation of prescriptions. In 2017, the opioid prescription rate was actually at its lowest in 10 years. That said, the Centers for Disease Control and Prevention report that well over 191 million opioid prescriptions were written within that year. So experts encourage talking with your doctor to see if there are other options maybe available. Again, we realize this is not always the case, and we will be addressing that coming up in future conversations and future stories.
Right, so millions of prescriptions means millions of unnecessary pills out there, and experts say just limiting accessibility to drugs can help.
Yeah, and for those who no longer need the medications, get rid of them. People often have prescriptions left over that are no longer necessary. So right now, if you have unused medications, take them to a drop-off location. Visit takebackyourmeds.org. Click on your town or your city, and it will tell you where to take those unneeded medications. And if that is not an option, put your medications, we are told, in old coffee grounds or cat litter and dispose of them in the garbage.
That's right. Make sure they're in there and then cover it up and put them in. 75% of opioid misuse starts with medication actually not prescribed to that person, but belonging to someone else. With that in mind, if you keep opioids in your home, then have one of these, a lockbox. It makes it difficult for someone to take them. Lockboxes are easily available and fairly inexpensive. We found this one at Target for $15. So easy to do.